Hello everyone. Today we are going to see about Grapitail. The chemical compound in that Grapitail is Grapiprant. The Grapitail is indicated for control of the pain and inflammation associated with osteoarthritis in dogs. The mechanism of action of Grapiprant is it's a non-COX inhibiting NSAID. The arachidonic acid is converted into 5-lipoxygenase and cyclooxygenase. The cyclooxygenase is in two different forms, COX-1 and COX-2. The COX-1 is responsible for the normal intestinal and renal functions, and COX-2 is involved in the inflammation, pain, and fever. So this will cause the prostaglandins release. These prostaglandins will go on bind with different receptors EP1, EP2, EP3, and EP4. The EP4 is particular for pain. The Grapiprant will go and blocks the EP4 receptors, so the pain and inflammation will be reduced. Why the EP4 receptor matters? The specific targeting is the magic of this Grapiprant drug. There are four receptors I have told previously: EP1, EP2, EP3, and EP4. The EP1, 2, and 3, which is responsible for the housekeeping functions, which are stomach mucus protection, acid regulation, and kidney regulation. The EP4 primarily responsible for mediating pain and inflammation, especially in the case of osteoarthritis. So, by blocking only EP4, the Grapiprant prevents the prostaglandin from triggering the pain signal, but the prostaglandin is still free to bind EP1, EP2, EP3, which will be involved in the stomach mucus production, acid regulation, and kidney regulation. So, the Grapiprant is a novel drug for osteoarthritic pain. The FDA approved to use in dogs from 2016. It belongs to the pipeline class of drugs. So it's non-cyclooxygenase, non-COX inhibiting NSAID, prostaglandin receptor antagonist. So the benefits of Grapitail is its first non-COX inhibiting NSAID. It only blocks the receptor of EP4, which will be in the mediator of the canine osteoarthritic pain and inflammation. And it's safe to use daily. You can give in for osteoarthritic pain. Can use for a longer period. It have lower side effects. It reduces the impact on GI tract, kidney, and liver homeostasis. The doses of the Grapiprant is 2 milligram per kg once daily. It should be given in empty stomach, particularly in the morning, at least 1 hour before next meal. So the features of the uh, COX inhibitor and the Grapiprant. So the normal traditional NSAIDs which blocks the COX enzymes, but the Grapiprant which won't block the COX enzyme, so it will be active. The prostaglandin production is stopped in the normal NSAIDs. In Grapiprant, the prostaglandin production is normal, and kidney, stomach were compromised. There might be ulcers and kidney failures will be there in traditional NSAIDs, which inhibit the COX enzyme. In Grapiprant, the stomach and kidney functions were preserved. The mechanism by inhibiting COX enzyme in this Grapiprant, I previously told EP4 receptor antagonism. The Grapiprant should be given to dogs after 9 months of age. The minimum body weight should be 3.6 kg body weight. It's not evaluated in breeding, pregnant, and nursing dogs. And Grapiprant not studied with in dogs with heart disease because there are lot of EP4 receptors in the heart tissues also. So when we are giving to pets with heart disease, we need to be cautious. We need to monitor the pet with blood test when we are using for a longer period in like in osteoarthritis cases. Grapipran should be given in dogs only. It should not be used for cats because it's not approved in cats.